Thank you both, Henrietta and Marlene. That was a great overview of kind of the beginnings of a community-based approach, as well as sort of the conclusions and evaluation of one as well. And for those of you who haven't seen, I haven't seen the video, Marlene, that you were trying to show of the young kids. I have seen the one of teens putting together sort of their own sports drink based on true ingredients in a sports drink, and they were pretty grossed out by the end of every single segment. No matter what the combination was, they were just flabbergasted, as was I. I really did not realize that that many types of sugar went into a sports drink. So so if you're really skeptical of, sports drinks really aren't that bad, watch a few of those YouTube videos and you will see. And it's great that it really is the kids as well. So those ads are really effective. We have a couple questions, but please keep sending them up here. One thing that I was kind of thinking about as we were listening to the presentations was both of you really did talk about your approaches to trying to reduce SSB consumption in sort of large geographic areas. Clearly, the Navajo Nation is huge. Howard County, one of the largest counties in the country. Most of the presentations and discussions to date have really been focused on specific policies or specific venues. So thinking about implementing sort of a community-based approach seems a little daunting. There's just a lot of moving pieces, and you have actually real people to contend with and real politicians who are like vetoing and passing and whatever that whole trajectory was. So, can you provide some insights and advice to others on how one might approach a broader effort to a population or a region regarding SSB intake? And Henrietta, I'll go ahead and start with you. I know the COPE project is sort of early on, so you can probably provide some insights into the importance of a lot of that community engagement that you're doing now.
Thank you. So one of the approaches that we are taking during this implementation phase with the needs assessment is we're really taking advantage of the community events that are happening throughout Navajo. The Navajo Nation President's Office is very supportive and has been conducting healthy food gatherings throughout the Navajo Nation and the 5 agencies. So we're using that as an opportunity to engage the community from different members, different chapters who are coming for this summit to really get their input. So, utilizing the community events really helps us, so we're not traveling throughout the Navajo Nation, to conduct these need assessment surveys. The Navajo Nation also has a Just Move It program. It's targeted toward the healthier approach. Well, they have a run associated with it, so we're utilizing those events to really move forward to gain the perspective of community members on Navajo.
So I think a couple of things made it a little bit easier. One is that there's county level government in Maryland, which isn't the case everywhere. So the fact that you had that structure there to work with, I think, helped address something that was throughout the county. It also was only one school district in the whole county, so that kind of gave boundaries to what you were doing and who you were working with. And then the third thing was that the Horizon Foundation, they are a Howard County foundation. So I think because they had been around for a long time, they already knew all the key players. They had been involved in lots of other initiatives over the years. So I think they were really the perfect ones to lead this because they had those connections. So things like setting up all the coalitions, I think was, much easier for them than it would have been for somebody from the outside coming in trying to do it.
And that's a good question. One of the things I was thinking with both, the COPE initiative is really inspired by funding from the Nota B'Aday Foundation, and clearly the Horizon Foundation has been really instrumental in Howard County. So I guess the question is that what it takes? Does it take an influential, funder to do this, or what advice would you have for other localities that perhaps don't have as much funding, might not have that community leader, but they do all have government structure? So that's a really good point in terms of perhaps finding a political leader to help. But what would be your advice in terms of seeking out those funding opportunities, or short of that, or if that just doesn't provide enough of the impetus, what could other localities look to if they don't have that, sort of golden egg there to help fund them? Henrietta, I don't know if you have some thoughts.
Sure. The COPE program really looks at collaborating with local partners, and that just seems to expand to one partner after another, and providing those resources and information, that's available. We are grant funded, so we continually seek for grants, and through that outreach, we're able to learn a little bit more about other programs, other agencies, other foundations that are looking at targeting specific areas, and if it's a good match with what the mission of COPE is, then we try, we keep trying and keep trying. And having the Navajo Nation tribal leadership, pushing the effort, it really helps in our efforts as well.
So I think the funding was a really big part of why this worked. And when our paper came out, one of the questions that I was asked was, well, so how much did this all cost? And the answer was about $800,000 a year. So that, is a lot of money. And I think that that shouldn't, though, dissuade other communities from feeling like, oh, forget it, we can't do it at all. You don't have to do everything at once. So to maybe choose different components and focus on those and build that way, I think, is definitely feasible. But I also feel like what I would love to see come out of this would be a way for communities to learn more about these examples, to be able to, have lessons learned and share materials and things like that, and to sort of have those sort of concrete, where you can really hear from the people who did it, like what happened, I think could also make it easier for other communities going forward.
Yeah, kind of like we are right here today. Exactly. And the other thing I was thinking of, now that I'm living in a small rural town in northern Indiana, that political leadership is key. If you can find allies, and like you said, Henrietta, the Navajo Nation passing the dine tax on food, you have leaders and you have real advocates for this space. And if you don't necessarily have the foundation funding or the funding in general, if you have true leaders that can allocate funding through that process, that would be critical as well. So trying to identify if they're there, and if they're not there, foster that relationship with policymakers. And another question that sort of relates is, when you get pushback on the politics and the policies of restricting access to SSBs, what arguments do you make to persuade stakeholders? And Henrietta, I'm really curious, in the Navajo Nation, if you did get pushback, clearly there's a truly deep-rooted sort of respect for water and land and the natural resources there. But I would also imagine the eating habits are not great, and that there probably is a lot of consumption of SSB. So have you experienced sort of that pushback, and how have you sort of pivoted and really helped get around that?
Well, actually, on the Navajo Nation, we've had a lot of support, from local community members, a lot of the tribal leaders, because they're all focused on creating better, healthier communities in which they live. So, if there are any pushbacks, then we really, bring out the voices of the community members themselves, that they themselves are looking for change within their communities. They're looking at not only within their household, having a healthier household, but they're looking, to the next generation and the generation on and the generation on.
So really thinking about the kids as well, I think, is
Yes.
important. Marlene, any other?
I mean, I think when you're focusing on kids, that always helps.
Yeah.
So, a lot of the, the policies in childcare and the school policies was really about the children. And so I think that politically, that was an easier sell.
Yeah, and I think having the voices of the kids, whether it's the daycare ads or the high school students with the soda, the sports drinks. And Marlene, specifically, some people are trying to use your research in a negative way, if you can imagine, to make the case for not working on taxes, because this is a community-based approach. So look, we can do it all this way without really needing taxes.
Right, yeah. So, but at the same time, yeah, it did. It went down statistically significantly. It went down 20%, which is a lot, but it's still up there. So I really think that, if we're going to get the percent of calories from added sugars down to that 5 or 10% that's recommended, there's still a lot more work to do. So we definitely don't see this as an either or with taxes. Absolutely not. We feel like this is, a bunch of strategies. Taxes are another strategy, arguably probably the most powerful strategy. So I think that we really see this as trying to use all the tools in the toolbox to move forward.
Mm-hmm. And one other thought is, Howard County is unique. It is the fourth wealthiest county, at least in 2010 in the country. But I think you also showed that there are pockets of poverty and there's a pretty wide-ranging diversity within the county. But thinking about smaller localities or, other ones that really just frankly aren't as prosperous, any specific takeaways that you thought of in terms of, it doesn't really matter, this could apply to a number of different localities?
I mean, everybody wants their children to be healthy, so I really feel like it's, talking to the community and tapping into, the messages here were about, you want to, give your children what's healthy for them. You want to buy the best, beverages for your child. So I think that, that really applies to all communities. And I think once you can kind of get the conversation to that level, I think people connect with it.
Yeah, absolutely.
I think another way of connecting, with the local communities also, I really appreciate the campaign that Marlene shared, but, one of the approaches that we are planning on taking is using the local champions, the local youth champions to promote. I think, visually having local athletes promoting the healthier choices, will take it a long way.
That's a really good point, especially in some of the smaller communities. There are local heroes that can really carry that message. One of the things that, Marlene, you pointed out in your slide in terms of the consumption rates in different venues, home-based approaches are still critical. The majority of SSBs are consumed in the home, and clearly you saw some movement in the right direction there, but it's just a pretty heavy lift. For either of you, are there any sort of takeaways or things that you see as possible opportunities? And it came up in the other panel as well in terms of, the home-based consumption is really where we need to, or there seems to be a lot more opportunity and a lot more challenges there.
Yeah, well, I mean, it's definitely harder to have, your home policy, but again, I think these retail environments, ultimately that's what they're affecting, is what people are bringing into their homes. So that's one of the reasons why I think taxes are so powerful, because they're affecting people at the point of purchase, products that they're buying to bring into their houses primarily. So that, as well as other retail-based strategies in terms of placement and sort of in-store messaging and things like that, probably that's a great place to move in order to have influence on those home purchases.
Another approach that COPE's had is we partner with local organizations, other than the health professionals within the Gallup area, Indian Health Services. So the local organizations do home visitation. It's a home visitation program where they're actually going into the home on a weekly basis. So that really helps promote that educational piece about nutrition, health, and especially reducing the consumption of SSB.
Interesting. Well, with that, there was one other question that we're not going to be able to get into because it would take a lot of calculation and statistics, but there was a question about the graph about the 25 pounds per year and the soda. So I'm actually going to let the person who asked that question corner you and possibly even Lynn Silver and possibly even Kim from New York, who can perhaps talk through those numbers and the statistics and how that's defensible. So with that, I'm going to ask everyone to give our great speakers another round of applause. And I think we're ready to